Hi, otitis media in children. A middle ear infection, also called otitis media, is a common reason for a child being brought to the doctor's office. Children's middle ear infections coincide with seasonal occurrences of upper respiratory illnesses. Bacteria are the cause of approximately 2/3 of these cases. The major symptom in older children is increasing ear pain, but infants may simply present with tugging at their ears. Earwax must be removed if needed to observe the eardrum. Some pediatric guidelines suggest that for children older than 6 months of age, without tubes in their eardrums, or who have a history of recurrent acute otitis media, antibiotics can be administered. For children with a perforated eardrum or hole in their eardrum and with purulent drainage, antibiotics can also be administered. Children with a middle ear effusion or fluid behind the eardrum and a bulging eardrum who look moderately ill and have a fever with a temperature greater than 102 degrees Fahrenheit or greater than or equal to 39 degrees centigrade should be administered antibiotics. For children with moderate to severe illness or severe ear pain, or those who have already been severely ill for 48 hours, antibiotics should be administered. Now, for children who are moderately ill, alert, and with a low-grade fever, a temperature less than 102 degrees Fahrenheit, less than 39 degrees centigrade, and who are responding to antipyretics, and who have mild ear pain and mild or moderate bulging of the eardrum, watchful waiting can be advised. Antibiotics or a prescription to be filled if symptoms worsen or do not improve in 24 to 48 hours can be provided to the parents for the child. Amoxicillin is the drug of choice if antibiotics are required, usually in 3 divided doses. A twice-daily regimen can also be used. Amoxicillin clavulinate, Augmentin, can be considered if there is a purulent conjunctivitis concurrent with the ear pain, a history of amoxicillin treatment within the previous 30 days, a relapse of a recent infection, or a non-response to amoxicillin. Other antibiotics called second-generation or third-generation cephalosporins can also be considered. If oral medication is not tolerated, intramuscular or intravenous ceftriaxone, a third-generation cephalosporin, might be appropriate. Physicians may consider 10 days duration of antibiotics in children younger than 2 years of age, and those with recurrent acute otitis media or acute otitis media with perforated eardrums. 5 days of antibiotics might be appropriate for children 2 years of age or older with uncomplicated disease. Your physician will determine the duration and type of antibiotic therapy. Adequate analgesics for pain relief should always be prescribed by the physician. If the prescribed amount does not relieve the pain, the physician should be notified and informed of the lack of relief. Well, I hope this helps. Have a good day.